Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, amid calls for stricter measures due to the Delta variant threat, President Rodrigo Duterte retains GCQ with heightened restrictions in the NCR Plus until August. Metro Manila mayors say they're ready to shift back to the strictest form of quarantine or ECQ, but they're demanding for more COVID-19 vaccines. And as cases continue to rise, are we doing enough to deal with a possible surge due to the Delta COVID-19 variant? Health Secretary Francisco Duque joins us live. President Rodrigo Duterte wants unvaccinated people to stay at home. In his latest talk to the nation, the chief executive wants a law punishing unvaccinated people from roaming around. Here's the president in his own words.
Kung may demanda ako na, yan ang utos ko. Ibalik ka doon sa bahay mo. Yan ang utos ni Mayor. Kung magdemanda ka balang araw, idemanda mo siya. Harapin ko yan. I assume full responsibility for that.
Meantime, amid the threat of the Delta COVID-19 variant, Mr. Duterte approves the recommendation to retain Metro Manila and nearby provinces under GCQ with heightened restrictions. Let's go straight to the source of the story. We have Health Secretary Francisco Duque III. Secretary, welcome to the source. Maraming salamat po sa inyong oras.
Yes, good morning, Pinky, and in behalf of the DOH and IATF, I'd like to thank you for this invitation.
Secretary, let's go through first and foremost the thought process. Why retain NCR Plus under GCQ with heightened restrictions?
Yes, that was the recommendation of our experts and also backed up by the data analytics group. And that is why this has been recommended for approval by the president last night. No? But the NCR mayors, we met yesterday. And since they are the implementing units on the ground, they have broached the idea that a higher community quarantine, if not the highest community quarantine classification, is something that they would welcome or that they would endorse, no, or recommend to the IATF. And that is why this afternoon the IATF is meeting once again to address the IATF to address the NCR, and not only NCR but also other regions where spikes or a relatively huge increase in cases has been observed.
Okay. So, Secretary, to be clear about this, right now, the decision of the president is for NCR, let me stick first to NCR and Plus, to stay under its current GCQ with heightened restrictions, as is po tayo ngayon. However, kayo po, the IATF, will meet with Metro Manila mayors today po, and does that mean that this status could change in the next couple of days?
Well, that can change, correct. As what happens usually is the LGUs, after they have been put in a certain risk classification, kasi apat yan, di ba? ECQ, MECQ, GCQ, and MGCQ. Some of them, they file their appeal to the IATF, and then the IATF looks at and reviews the metrics that guide the IATF decision. We're looking at the average daily attack rate, no? Which is really the measuring the risk of infection in a community, and followed by the 2-week growth rate, which measures the speed of the spread. And then, of course, very importantly, the healthcare utilization rate, no, and in particular ICU utilization rate. But we're also looking at the socioeconomic impact of this. So it's a more holistic approach to reconsidering the particular community quarantine classification that LGUs are put under but subject to appeal.
Opo. But why not, siguro? Let me reverse the question. Why hindi po inisip o ni-recommend rather ng IATF kay Pangulo na mag-lockdown muna, madaling salita na lang po, mag-lockdown muna tayo sa susunod na 2 linggo para po we are able to possibly prevent the further spread of the virus?
Well, the IATF does that. It's not the first time it's going to do it. It will consider everything because, you see, locking down is easy, but you need to identify the social amelioration funds. For example, meron masapat na kaperahan para masuportahan yung mga matinding maapektuhan ng lockdown or stricter lockdowns, no? But by and large, the LGUs naman are already empowered to do their own localized or granular lockdowns in areas where clearly there has been a clustering of cases, no? So it's already part of their standard operating systems to do granular lockdowns. But here we're talking about, because of the threat of the Delta variant, and now it's already here, although hindi pa siya yung dominant variant, because based on our genomic sequencing, the dominant variants are still the Beta and the Alpha variant at probably about 24 and 22% respectively of all the samples sequenced, no? While the Delta variant is about 1.4, 1.5%. No? So that's why maganda nga dito sa ating genomic sequencing, talagang maaga pa nalalaman na natin ano ba yung dominant variant, and then we recalibrate our response to the COVID-19 pandemic.
Opo. But Secretary, yung pong kasi sa genome sequencing, there are a number of concerns about that. But I want to go to that later. Dahil nga po, we only test about 750 cases a week. Sabihin po natin na we average about 5,000 a day. That's about just 2% genome sequenced every week out of the 5,000 average a day. So that's a very small sample. But I'll go to that a little later on, because also the Philippine Genome Center wants additional offices in the Visayas and Mindanao, which would cost about 100 million pesos. Balikan ko lang po. So, ang dami na kasi umiikot na text message. I'm sure you know about it, sir. Na lockdown na po tayo beginning August 1. So, for the record, yung pong mga umiikot na magkakaroon po ng lockdown ng August 1 ay hindi po ito totoo, Secretary.
Fake news. Fake news, Pinky. Ito na yung hawak-hawak ko na yung piniset namin kahapon. I think you already have seen this, no? The different columns and what are the provinces, highly urbanized cities, and independent component cities under what classification. And this document shows that. No? So ang NCR dito nakalagay, as of last night that it was announced, is GCQ under with heightened restrictions, no? So National Capital Region, Ilocos Sur, Cagayan, Bulacan, Laguna, Lucena, Cavite, Rizal, Naga City, Antique, Aklan, Bacolod City, Capiz, Negros Oriental, Zamboanga del Sur, Misamis Oriental, Davao City, Davao del Norte, Davao de Oro, Davao Occidental, and lastly Butuan City. So ito ang tama. Ito ang genuine.
Yan dapat ang umiikot, sir.
Ay, umiikot, wala yun. That is fake news.
Sabi ko po, yan pong hawak-hawak nyo, yan po dapat yung umiikot. Kasi yan po yung tama.
Yes, you're right. Sorry. Yeah, ito dapat ang umiikot. Oo.
Okay.
Paikutin na natin. Oo. Yeah.
Sige. So, okay. So, but again, Secretary, that can change. Ano po? Because you are going to meet, the IATF will be meeting with the Metro Manila mayors, if indeed it changes. When could this possibly happen? Because it's already July 29.
Well, malamang yan. August 1 yan to August 7 or up to August 15. Nag-meeting na kami with the Metro Manila mayors yesterday. No? And kaya nga hindi naman kaagad pwedeng baguhin yung community quarantine classification ng NCR kasi nga, marami pang mga tanong na since last night and today, we are getting more data, we're getting more information as to, for example, the availability of social amelioration budget, no? And then the commitment, for example, of the NCR mayors to really intensify their PDITR strategy, no? Kasi they really have to intensify their contact tracing activities, their testing, their aggressive isolation using the Oplan-Kalinga model, no? So ramping up of their local healthcare capacities, no? Yung kanilang mga TTMFs, isolation, quarantine facilities, their local government hospitals also, no? So maraming silang mga gusto rin i-commit na gagawin nila basta mabigyan din sila ng additional vaccines. I think they're asking for about 4 million. Yes, that's right. So hopefully we can be able to ramp up vaccination coverage in NCR to close to about 50%, so that there will be more appreciable or substantial protection, and therefore there will be less severe cases, there will be less hospitalization, and presumably also less mortality.
Opo. So I need to go on a break, sir, but I don't want to cut this train of thought. Ano po? Yung hinihingi po ng Metro Manila mayors na they're ready for a lockdown as long as two things. There is SAP and there is 4 million vaccines. I want to ask you, sir, is this possible? Is possible ho ba si SAP at possible ho ba si 4 million vaccines sa NCR?
We are taking a stock, yung inventory natin, ano? May mga darating pa tayo. This morning, meron tayong dumating 1.5, and then I think tomorrow another 1.5 or 1 million. So we are going to make our computation, ano? And we'll hopefully we'll be able to reallocate bigger percentage of vaccines sa NCR, where the Delta variant can rapidly potentially spread, no? So yun ang pinag-uusapan sa ngayon, at mamaya we hope to be able to have clearer, more definitive figures.
Got it. Secretary, we just need to take a very short break. The source will be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today, Health Secretary Francisco Duque. Secretary, just some concern. I'd like you to address this, that some people may think that we are not acting fast enough, knowing that the Delta variant is here, numbering 119 so far. Yung sampling po natin sa Genome Center medyo mababa. Dahil yun lang po yung kakayahan ng Genome Center ngayon. Yung pong sinasabing reactive tayo rather than proactive. What do you say to that?
Well, baliktad. We are proactive, not reactive. The fact that we still have low numbers of Delta variant is already proof in itself, no? That the Philippine Genome Center has been doing a good job of really identifying or detecting among the positive samples the different variants. Since January, di ba? Na-identify nila yung UK variant, which is the Alpha, and then sumunod yung Beta variant, and then sumunod yung I think the Gamma, which is the P.1.
P.3.
P.3 is that is a Philippine variant, di ba? That's the Theta. Theta yan eh. Eh wala na yan. Tinanggal na yan sa listahan ng variants of concern. But for monitoring na lang siya, no? So, unang-una, we have to have a better understanding of what the genomic sequencing is all about. It is really a biosurveillance tool, no? You do sequencing of the virus to identify yung mutation niya, yung variant, saan yung mutation niya within the sequencing, ma-identify nila yon. Kaya nalaman nila yan. But it has nothing to do with case management. Hindi naman hindi mo, kasi number one, there's no country, Pinky, that does sequencing of every positive sample. That no country does that. In fact, ang Philippines nga, tayo na may in terms of absolute numbers, tayo na isa sa may pinakamalaking sequence specimens, no? Almost mga 8 to 9,000 yan na na-sequence na natin. Sa Malaysia nga, last week, 55 lang na sequence nila eh. Kaso of the 55, 100% Delta variant yung nakita nila.
I see.
No? So sa atin, marami tayong mga variants pa rin na track down natin, and which is good, no? Because we're able to monitor them, and it is able to guide the national and the local governments in recalibrating the pandemic response. No? So ngayon, alam na natin the Delta variant. Alam na natin it is 6 times, it's 60% more transmissible. Alam na natin it is 3 times more contagious than the original Wuhan virus. No? So we now intensify our PDITR plus vaccination response or strategy to be able to really contain this. And while it is still low, we are already requesting and have been appealing to the local government units. This is the time to do it. Not when you're already having the spikes or huge mega increases. No? So habang mababa pa tayo, you do it now, be more aggressive. You already do contact tracing, aggressive yung active case finding, and then you do contact tracing, and then you do testing, and then aggressive isolation or quarantine. So parang mapping up operations tayo, yun ang sinasabi ko. Hindi madali, nothing is easy with this pandemic. But it is much better to do that now while the numbers are still low. Not when they're already, really huge increases in the number of cases. Now, ngayon kasi, yung H-curve natin, the healthcare utilization rate natin, manageable pa naman. It's still in the safe zone. But it's moving up. No, there's no denying that the utilization rate is going up. But that is why we continue to monitor. And part of the monitoring tool is the biosurveillance coupled with our strict border control and enforcement of our 14-day quarantine protocol. You know what happened, Pinky, in Indonesia? Napag-alaman namin, 5 days lang yung kina-quarantine nilang mga galing abroad pagpasok. Nagkaroon ng search and death at tinaas nila to 8 days, which is still superficial. It is a token quarantine. That is why the search there happened. No? So sa atin, we're being very careful. Alam mo naman yun, we have a 4-door strategy. First door natin, we did travel restrictions to now 10 countries. Recently, it's Malaysia, Indonesia, Thailand. Prior to that, we had 10 countries. So that's part of our strategy. And door 2, strict border control, strict symptom temperature screening, our testing in the seaports and the airports, and then strict quarantine protocol compliance. And then, of course, door 3, kung nakapasok na yung virus, ito na nga, nakapasok na, ang Delta, andito na. Sagot? PDITR plus strategy, di ba? So prevention, early detection, aggressive isolation, treatment, and saving lives of severe to critical COVID cases. No? Kaya nga pinalalawad natin ang ICU natin and everything. No? Plus vaccination. No? PDITR plus representing vaccination. So
You mentioned health.
Sa NCR, we are about at 30% na ang atin second jab coverage of the population of NCR.
Secretary, you have been mentioning the healthcare utilization, and I've been looking into this. Let's understand the situation. I'm just going to stick first to NCR. Kasi puro po ito, we're looking at normally percentages. Ang ICU beds po natin dito sa NCR, 46% ang utilization. That seems okay, hindi ho ba? Dahil hindi pa siya lampas ng kalahati. Pero pag tingnan niyo po yung numbers na yan, that's only 1,100 ICU beds in total. Ibig sabihin, 46% has been utilized. That's more or less half. Let's put it at 500. Ibig sabihin, 500 ICU beds na ang nagagamit at meron pang 600. That's how I'm understanding the graph of the DOH. Now let's look into the daily cases here in Metro Manila. Umaabot na po tayo ng 1,000 daily cases. If you look into the critical and severe, that's 1.4 plus 2.3. That's almost 4%. What I'm trying to point out is that it seems with this graph, sir, there are 40 patients who will be critical and severe every single day. In 1 week, that will be 280 people who will be needing ICU because they are critical and severe. Sir, in 2 weeks, 500 beds na po yun. Ito pong ICU utilization natin, mauubos na in 2 weeks. Could you please respond to that?
Well, ganito yan eh. If you look at the tracking or monitoring system, ilan ba yung active cases? Active cases, ibig sabihin yung current na siguro mga 2% yan or 3% mga critical, severe to critical cases. No? Merong aalis, may anong tawag
May
dito?
mawawala. Opo.
They will be put to the isolation. Okay, once they've gone past the critical stage, no. So magre-recover sila, ililipat sila. So may papasok na naman. So kunyan, constant yan. May lalabas, may papasok, may lalabas, may papasok. Hindi naman yan nakapigil ka sa dulo tapos mapupuno. May lalabas at may lalabas. Alam na natin yan, nakaprogram na yan. Ilan ang lalabas, ilan na mapupunta sa lower level facility for example or lower level care, di ba? And then make the ICU bed capacity open. You open it up again, di ba? You can accommodate. So ganun yan, may stream. No, may lumalabas, may lilipat sa isolation room, may lilipat sa ward bed, no, to give way to the next in line who will require ICU care. So ganun yung sistema.
I understand that, Secretary. But again, while it's true na natatanggal po sila sa ICU, they stay there for quite a while. They stay there for 5 days and sometimes even 2 weeks. That's why that is a concern that I wanted to raise with you. Dahil nga po, ito ho kasing 46%, while it is accurate, it might not really give us a clear picture ilan pang ICU beds ang natitira, which is right now about 500 to 600 beds. Secretary, we need to take another short break. The source will be right back. You're watching The Source on CNN Philippines. Our guest today, Health Secretary Francisco Duque. Secretary, last night you were with the President, ano po, at sinabi nga niya, yung mga unvaccinated, gusto nga niya parusahan or stay at home. What will be the policy in the next couple of days? Dahil nga po, it seems, no, marami na pong gusto magpabakuna. Meron pa rin pong may ayaw, kaya lang either umuulan, they are queuing up, hindi sila umaabot, o kaya kulang ang bakuna. Although, of course, I understand, sir, na tuloy-tuloy ang pagdating ng bakuna, especially no lately. What's the plan dun sa mga unvaccinated right now?
Nawala siya.
Secretary, now we're back. We're on air. I can hear you now. Okay. Did you hear my question,
Yes.
sir?
Partly. Can you repeat it?
Partly. Sir, ano pong plano sa mga unvaccinated individuals? The President also spoke about this last night.
Yeah, alam mo, ang number one issue dito is still the supply. So we are hopeful that there will be more vaccines to come and in bulk. No? If we're able to do that, then it might really make a lot of sense to incentivize people to go out once they are fully vaccinated. No? I think that is really just the point the president wanted to get across. No? Mm-hmm. So unless we get a stable supply, no, of our vaccines, no, yun ang context with which the president made a statement last night. No? So we incentivize yung mga tao, and we're all already doing that for our senior citizens, di ba? We're saying that they can already go out. So it will be the same for the other groups, okay, within the priority framework. But Bingy, can I just respond very very quickly lang doon sa bed capacity ICU?
Yes, sir,
Very quickly
please.
lang. If you don't mind.
Please,
Okay,
sir.
dalawa kasi ginagawa natin sa national government and the local governments. Number one, we continue to ramp up what I call the institutional COVID ICU bed capacity. Okay, pinapalawag natin from 700, we're now about close to 1,200 beds. Tama ka, COVID lang yan. Hindi yan natin sinasama yung non-COVID na ICU. Meron tayong mga non-COVID. Meron din tayong ginagawa dahil syempre, kung nagkakaroon ka ng spikes, mataas ang cases mo, marami kang mga papasok ng pasyente, tama yung sinabi mo, mga 1 to 2%, severe to critical, meron tayong accordion.
Secretary, I'm losing you, sir.
Nagagamit. So may 35%, example lang. Yung 35%,
our signal is not good with Secretary Duque right now.
okay na? Okay na?
Pasensya na, sir, we lost you at some point.
Yeah. So, sabi ko, meron tayong accordion policy or accordion approach. Alam mo yung accordion, ano? Kung nag-spike, magko-convert ka ng isolation mo beds to ICU beds. Kasi alam mo, Pinky, it is foolhardy to keep your ICU beds empty when there are also non-COVID ICU cases that need to be also taken care of. So you have to be flexible. Hindi pwede sabihin mo, ito lang ICU bed to for COVID, huwag yung gagamitin ito. Di ba? Meron na nga tayo ganun. Meron tayong institutional na nakalaan para sa kanila, but we cannot go beyond what we have now, institutionalizing it, making it permanent na kahit na walang surge, okay, you're in a relatively quiescent stage of COVID, mababa ang kaso, walang pupunta sa ICU, meron kang option to use that to do critical care for non-COVID cases. Marami din yan. Heart attack, yung mga stroke, napakadami niya, post-operative, ang dami niyan eh. So you really have to be able to move around. You have to be agile in allocating, reconversion. So that's the way we do it. Thanks.
All right. Secretary, thank you so much for your time. Maraming salamat po.
Okay. Salamat, Pinky.
Thank you, sir. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.